Mrsa, when bacteria fight back. What is Mrsa? Mrsa stands for methicillin-resistant Staphylococcus aureus. Staphylococcus aureus, also known as staph, is a common bacteria that has become resistant to methicillin as well as other antibiotics. Mrsa infections can be acquired in the hospital and in the community. Community-associated Mrsa is acquired by persons who have not recently been hospitalized or had a medical procedure. It is usually seen in the community as skin infections such as pimples and boils and occur in otherwise healthy people. Healthcare-associated Mrsa occurs frequently among people in hospitals and healthcare facilities such as nursing homes and dialysis centers who have weakened immune systems. Mrsa lung infections. Mrsa has the ability to spread to the organs of the body and cause complications as well as infections on the skin. One of the complications that can result from Mrsa is a lung infection or pneumonia. People with pneumonia due to Mrsa can transmit Mrsa by airborne droplet. Healthcare workers as a group are repeatedly exposed to Mrsa-positive patients and can have a high rate of infection if precautions are not taken. Consequently, healthcare workers and patient visitors should use disposable masks, gowns, and gloves when they enter a Mrsa-infected patient's room. Symptoms. Mrsa usually begins as one or many small red spots. These spots may look like pimples, spider bites, or boils. Some infections may have a black spot in the center of it. This is a characteristic symptom of Mrsa. Mrsa infections spread quickly. While initially it may be localized to only one spot, it will rapidly increase in size and depth, turning into abscesses. Some abscesses require surgical draining and treatment. Hospital-associated Mrsa may occur in a wound that is already open, such as a pressure sore or a surgical wound. In this case, the symptoms appear as an infection of the site with redness and heat radiating outward from the site. Also, there may be discharge. If a Mrsa infection gets bad enough, it may seep into the bloodstream, causing a systemic infection. It can also affect specific organs such as the heart and lungs. It may even enter the joint spaces, causing damage there as well. Causes. Poor hygiene. Colonize means a person has staph on their skin or nose but are not sick or infected, but they're still able to pass it to others. Staph infections can be found on the skin and in the noses of 1/3 of the population. Direct or indirect contact with the infected person. Antibiotic resistance is caused from unnecessary or excessive antibiotic use, antibiotics in food and water, and germ mutation. Risk factors for community-associated Mrsa. Young age. Often entering the body through a cut or scrape, Mrsa can quickly cause a widespread infection. Children may be susceptible because their immune systems aren't fully developed, or they don't have antibodies to common germs. Participating in contact sports. Community-associated Mrsa has affected sports teams. The bacteria spread easily through cuts and abrasions and skin-to-skin contact. Sharing towels or athletic equipment. Community-associated Mrsa has spread among athletes sharing razors, towels, uniforms, or equipment. Having a weakened immune system. People with weakened immune systems, such as those living with HIV or AIDS, are more likely to have severe community-associated Mrsa infections. Living in crowded or unsanitary conditions. Outbreaks of community-associated Mrsa have occurred in military training camps and American and European prisons. Association with healthcare workers. People who are in close contact with healthcare workers are at increased risk of serious staph infections. Risk factors for healthcare-associated Mrsa. A current or recent hospitalization. A 2007 report from the Association for Professionals in Infection Control and Epidemiology estimated that 46 out of every 1,000 people hospitalized are infected or colonized with Mrsa. Living in a long-term care facility. Mrsa is also prevalent in these facilities. Carriers of Mrsa have the ability to spread it even if they are not sick themselves. Invasive devices. People who are on dialysis, are catheterized, or have feeding tubes or other invasive devices are at higher risk. Recent antibiotic use. Treatment with fluoroquinolones or cephalosporin antibiotics can increase the risk of healthcare-associated Mrsa. Prevention. Keep your hands clean by washing thoroughly with soap and water or using an alcohol-based hand sanitizer. Keep cuts and scrapes clean and covered with a bandage until healed. Avoid contact with other people's wounds or bandages. Avoid sharing personal items such as towels, washcloths, razors, or clothes. Wash soiled sheets, towels, and clothes in hot water with bleach and dry in a hot dryer. And lastly, use antibiotics appropriately.